Hey everybody, how are you? My name is Mike Zagari. I'm the owner of Go Physical Therapy and Wellness. And today I want to talk to you a little bit about Parkinson's physical therapy and what we can do to help patients who have Parkinson's. You know, up until a few months ago, it was quite difficult when treating a Parkinson's patient. You know, we got mixed results at best. It is a progressive condition, and physical therapy is certainly needed to help patients maintain their ability to do functional tasks throughout the day. But again, results were lackluster and slow, if anything. But recently, I've taken a course called Parkinson's Big by LSVT Global. And you can see the website here. And this technique has been fantastic. It's a high energy technique. It requires a lot of effort from both the patient and the therapist, and also supporting family members and caretakers and aides, because it really focuses on really big, high amplitude movements. You see, the thing is, with Parkinson's patients, sometimes they don't really typically know that their movements are very small in amplitude. They're very tiny. They're taking small steps. For example, they don't realize sometimes that they're not talking very loud, and they actually say that their spouse or significant other can't really hear them very well. But meanwhile, they're really just not vocalizing and enunciating as loud as they should, because there's a disconnect in the amplitude, in their movements, in their speech pattern. So this technique called Parkinson's Big is a phenomenal technique. And basically what it is it's 1 hour sessions, 4 times a week with the therapist for 4 weeks. And the patient is also required to do an additional hour of exercise each and every day, and 2 hours, 1 hour in the morning and 1 hour at night or in the evening when the therapist is not coming. So is it a high intensity program? Yes, it is. But it is very comprehensive and very thorough, and the results can be quite dramatic. I've seen patients really improve their walking, their getting out of bed in no time with this technique, simply because there's a disconnect in their ability to realize how much amplitude they should put in a specific movement. And after 3 or 4 weeks, once this becomes entrained in the brain, and once people get used to doing bigger movements, it starts to become part of everyday life. So I really highly recommend it. It's definitely a commitment, but 4 weeks goes by super fast. As you can see, the website here is lsvtglobal.com, and there is a way to search for providers, and I am a provider of this technique. I'm the only one in my company who does this right now, but we're going to be trying to train a bunch of other therapists to do this as well, because the results are great too. There's also a technique called LSVT Loud, which really helps patients with Parkinson's enunciate much louder. And again, that's a month treatment as well. So if you have any questions, you can go to our website. This is our website here, www.goptw.com. Again, we do physical therapy anywhere in the New York area. I treat patients in and around the Nassau region, mainly the North Shore. But for this, I will be willing to travel. Could probably only handle about 2 to 3 cases at a time, because this is very extensive. But you could always give us a call at this number here, and you could email me at goptw1@gmail.com. It's been a pleasure, and hope to talk to you all soon.